If you're turning 65 and facing Medicare decisions, you're going to want to hear this. I mean, most folks coming up on Medicare don't really have the basic understanding of how the program works. And there's 4 parts of Medicare. There's Part A, which is your hospital and skilled nursing. And you've been paying for this all through your working years, through your taxes, but there is no premium for Part A, and that's your hospital insurance. Then you got Part B, and Part B is your doctor and outpatient. And you're going to, if you sign up for Medicare, most folks pay $144.60 a month usually out of their Social Security check. And people with a high income are going to pay more, substantially more. So there's some consulting and there's some things we can do if you have a high income that you're going to want to get in touch with us, and we can explain IRMA to you. And then Part A and Part B make up the majority of the Medicare payments and the majority of the benefits for when you're in the hospital, you go to the doctor, you have surgery, or you have things like that. And so it's important to understand what Medicare pays, and then furthermore, what Medicare doesn't pay and what your cost sharing is with that, because we're going to talk then about Medicare supplements in just a second. Now, Part C of Medicare is something that was invented about 15 years ago, and what it is you're receiving your Medicare Part A and Part B by election. So you make that election to receive your Medicare from a private insurance company. And you say, well, why would I want to do that? Well, there's several reasons. One is you don't really need, or you can't purchase a supplemental policy to go along with C. There's some reasons you wouldn't want to do that. One is that you've got to go to their doctors, okay? And that's a big stop sign. So, but many people go on this, and we represent most of the major companies that offer Plan Cs. And, you know, if you come to us for consulting, we're going to go over this option with you. But many people don't take a Part C, and you don't really need to learn about it if you just understand Part A and Part B, and then if you make an election to Part C, well, then you've done that. Part D is something that was added about 15 years ago, and that's for your prescription drug coverage. And it's a separate part of Medicare, and you sign up for this, not with the Medicare and the Social Security Administration, but you sign up for this through somebody like me, an insurance professional that offers you the various prescription drug programs. Now, what we want to go over with you is this Medicare supplement insurance. We're in the business of offering Medicare supplement insurance to clients like you in all 50 states and the District of Columbia. And we do that by telephone. And what you do if you decide to work with us or somebody like us is you open yourself up where we represent most of the companies that sell Medicare supplement insurance, as well as most of the companies that sell these Part C plans. So we can go through and compare and consult and really get you with the right company. Now, when it comes to Medicare supplement, what I want to talk about first is this open enrollment. And this is key. So when you're first coming on to Medicare, when you're turning 65 and you first come on and sign up for Medicare, you're entitled to buy any of the Medicare supplement plans offered in your state at the same price as everybody else. So they can't ask any health questions when you're in open enrollment. So if you've got a serious chronic disease, or if you've been on Medicare all along through disability, this piece of it, this open enrollment, is going to be very important to you. And it's key, and it's key that you make a good decision during this time, because if you make a bad decision and you later want to change it, you're going to have to answer health questions. And, you know, we have customers all the time that buy a policy from us, and they've got cancer going on right now, and it begins immediately paying for their treatments. Or people on kidney dialysis, people with some very serious health conditions. Medicare and the government have made certain that you can buy supplement when you first come on there. Now, this is another important point to understand here, is that the government has mandated standardized Medicare supplement policies. And what that means is that the policies that the different companies sell are exactly the same. They have to be. And they've named them according to the letters of the alphabet, which just adds confusion because they've used ABC for Medicare itself, and then they use ABC for the supplements. And I can't do anything about that. But to make this thing brief, the plan with the most benefits that combines with Medicare is the Plan G. So, and what most of our customers that are in your situation do, that become our customers, they sign up for A, they sign up for B, they purchase a separate D plan through us, and then they sign up for the Plan G with the most competitively priced company, of which that's going to be different in all the different states, and that would be a Plan G. And I've put some estimates here where it's about $100 a month, okay, and is about an average for a person turning 65. Now, if you live somewhere like Florida or New York or California or Connecticut, it can be as much as double this, just because costs are higher there and regulations are different. But we can help you in all those states as well. I've just put some averages across the country. This is about what you can expect. Now, I've also listed the Plan N because to me that's the next best alternative if you want to save a little money on your premium and you don't really give up too much with an N. They're going to be an average of about $80 a month. Now, for those of you that are still working and you're wondering, well, this is the largest question that we get coming in on Facebook and that people are calling us up and asking, say, I'm still working. I listened to your video. I want your consulting. Do I need to sign up for all this stuff if I'm still working and get group insurance? And the answer to that is no. I mean, you're not going to want to sign up for this. What you're going to want to do is you're going to want to sign up for Part A, unless you're part of a health savings account. I'm not going to get into details of that, but you're going to want to sign up for Part A only. It's premium free, and so you could possibly get some extra coverage. You're going to want to delay B, and you're going to want to delay Part D. And you'll be given another open enrollment when you retire, if that's a 66, 67, 68, whenever that is, you'll get a chance to sign up for this, and then you'll be given an open enrollment with your Medicare supplement. Now, for those of you that are turning 65 and you're coming along and you're wondering, where do I sign up for Medicare? Well, you sign up for Medicare through the Social Security Administration. And a lot of folks think mistakenly, they think that Social Security starts at 65. And you can sign up for it at 65, but you're going to get less. So if you were born in 1955, your full retirement age is 66 and 2 months. So that's where you're going to get your full retirement benefit from Social Security by waiting until 66 and 2 months. If you're born in 1956, that's going to be 66 and 4 months. Now, like I said, you could start it at 65 if that's what you've been planning all along, but you're going to get less. You actually could start it as early as 62, and you're going to get substantially less. Some of you may already be on Social Security, and so you're getting less, but you've been collecting it and it's working out okay for you. You're going to get a benefit from that in that they're just going to sign you up for Medicare Part A and Part B and mail you the card about 3 months before your 65th birthday. So, but if you don't get that card in the mail, you're going to need to contact Social Security and Medicare and talk about it. And we help a lot of clients do that and walk them through it. So, this doesn't work out the same for everybody. You got a lot of decisions to make throughout this, and as well at the same time, Social Security decisions. I left out one point here is with if you're the spouse of a person, if you're currently married, or you were married but you're divorced, or you're a widow or widower, you could possibly receive Social Security benefits based upon your prior spouse earning record, or even your current spouse. So I'm not going to get into the details of that. We're financial planners, certified financial planners, CFP, And we've made a study of all of this in working on retirement. And everybody's situation's different. We can sit down with you, look at your options, and, of course, we're going to do this on the telephone, talk to you several times and help you on a plan. I've written a couple of books about this. You can get these on Amazon. You can find them at our website, which is right here. Simplest way is just to give us a call. I'm Hans Scheil, and I thank you for listening.